All right, we are back with human growth and development, talking about the reproductive glands. So, for XY chromosome males, they have testes or testicles. These are the glands that secrete the hormone called testosterone, which is responsible for your body going through puberty, but also for sperm production. When we go over the anatomy, we'll talk about what sperm is, but in general, it is the reproductive sex cell for males. For XX chromosome females, they have ovaries for their reproductive glands. The ovaries secrete actually two different hormones. One is estrogen and the other is progesterone. So estrogen is the main hormone responsible for a female's body to go through puberty, but then the estrogen and progesterone also work together to regulate menstruation or the menstrual period for women, but then also help maintain a pregnancy if and when a female becomes pregnant. So, some puberty changes that happen for males because of that testosterone. Some are very similar to what girls go through. So, for both males and females, they're going to have hair growth. For the most part, women don't get hair on their face, but some do. That's really the only difference. But both boys and girls will get pubic hair, underarm, arm, chest, leg, all of that. Yes, ladies, you can get chest hair. It's not going to be as much as boys and the same on your face, but it's definitely possible. Body odor, acne, weight gain, growth spurts, and dramatic emotional changes are all normal for both males and females. Some things that are specific for males during puberty growth or puberty changes would be the vocal changes. So your larynx is going to grow and your voice will deepen. This might not happen for a few years for some of you, but also you might start noticing that some of your friends' voices are starting to crack. And that's just because that larynx is growing. Increase in muscle mass is another thing, and widening of shoulders. That's all caused by the testosterone. As we said, the testicles will start to produce the sperm cell. And then something else that is specific to boys is something called nocturnal emission, or it's also known as wet dreams. And this is just when there's an ejaculation of semen out of the penis during sleep. All of these changes are normal and natural for the XY males to go through. XX females, like I said, some of these you'll notice are the same as what you saw on the male slide, but other things that are specific to females would be breast development. Our hips get a little wider as women, just because that helps kind of balance the weight if a woman becomes pregnant. And then the other thing would be ovaries produce eggs or ovum, and that is the female reproductive cell, which we'll go over when we do the female anatomy. And then also menstruation or having your period is a specific puberty change that happens for girls. So some things to remember that are really, really, really important. Make sure you are taking a shower or bath every day or every other day to make sure that you are staying clean. You can also use things like deodorant or antiperspirant to help reduce the body odor. You should already know this, but brushing your teeth twice a day, every day is really, really, really important. I'm sure you've all been hearing that since you were young. And also make sure that you are wearing clean clothes every single day, including your winter gear. Winter gear doesn't have to be cleaned every day, but it should be washed regularly. Also, wash your hands. We are obviously 2020 pandemic right now, so it is something that you've heard numerous times, but these are just some other different bacteria, viruses, and fungi that can be found in schools commonly. So make sure you are washing your hands. All right, and we are going to do anatomy next.